And good evening, good afternoon, good morning, whatever time you may be watching this. And I want to thank you all for watching this. And I just noticed that it says that I am what he's doing today. However, this is another episode of talking about the Congo. Sorry for the heading there, but this is talking about Congo. And the subject today is tomorrow, which is May 5th. May 5th is the World Hand Hygiene Day. Hand Hygiene Day. And that's a little bit different from what uh, Hand Washing Day. This is more geared to facilities such as clinics, hospitals, and everything, because those places have been notorious for spreading disease and also infection. So some of the things that they want to do is make sure that the care facilities are taking care of their hand hygiene so that they don't spread disease or spread infection. So they're looking for, you know, you know, trying to make sure not only with washing their hands, but also using a little cleanser, a little sanitizer, and making sure you get your hands thoroughly hygienically clean before you start interacting with patients and things. But we all know that through this COVID pandemic, we have had a lower incident of disease, flu, all types of diseases, because as a result of heeding the CDC's warning and good hygiene, we've been really washing our hands and washing those germs away. As this campaign says, a few seconds will save lives. Seconds save lives. And so when we wash our hands, we want to do it for about 20 seconds. But with the hand sanitizer, you just want to make sure you rub it, enough of it, put it on there, rub it between your hands, between your fingers, fingertips, and then let it dry, and then you're good to go. So a little different, but the same effect. We want to reduce the amount of infection and contamination to people from one hand to bodies and stuff like that. So we all know again that we have to, for COVID-19, wash our hands. You can also use sanitizer if you're in a situation where you don't have water. And that's one of the things that's in the Congo. A lot of facilities do not have water on the premises. So their water will be very limited, and they would have to uh, use hand sanitizer if it's available to cleanse their hands more frequently because they don't have water available. Uh, one of the things that we've been looking at is getting each health facility having a some rainwater catchment, and that will at least wash the dirt and stuff off. And if you filter that water is just as clean as it would be for drinking and any other thing. Rainwater is good. It's not. You do have to filter it in a lot of cases because it could have some type of contamination from the roof that it was caught from. Because you have birds flying over above with droppings and things like that. And then you can also have mosquitoes in there, but I have not known mosquitoes to uh, that's mosquito larvae, that is, to transmit disease, but most people hadn't looked at it. So tomorrow, the May 5th, which is also Cinco de Mayo, think about making sure your hands are clean. clean your hands tomorrow. Every chance you get, wash them is preferred. But if you in some situations where you can't wash it, please use hand sanitizer and make sure you rub it. Put enough on your hands to rub it completely all over your hand and make your hands wet. And then when it dries, it will kill all those germs. So thank you all for coming tomorrow, and please use the hashtag tomorrow second save lives to recognize that we want our healthcare facilities to be in the best shape and not be in the position of transmitting infections to the patients or from patient to patient from one another. So thank you all again, and we will talk to you on tomorrow. And please, in the meantime, let's get this pandemic under control. Number one, let's wash our hands and use hand sanitizer. Number two, let us socially distance ourselves. And number three, let's wear our masks. And finally, for those who have the vaccine available, please consider getting the vaccine so we can get this pandemic under control. Take care, and we will talk to you tomorrow. And remember, a few seconds saves lives.